to report today, and 4 new cases from hotel quarantining. The 2 new local cases are both children and have no community exposure sites during their infectious period. One is a contact of the positive case that we reported last week linked to the Reservoir household, and one is a contact of the City of Melbourne case that we announced over the weekend. We expect to see more known about the close contacts positives as they more widely move their way through the day 13 quarantine clearance. What these figures tell us, continue to give us confidence, is that the system is working and that the public health settings that we have in place at the moment are appropriate. And what I want to do is thank all of those people, particularly those primary close contacts, for doing the right thing as increasing numbers of them come to the end of their quarantining period. And we do, of course, continue to offer support to those people as they make their way through that important work. As of yesterday, the Department of Health still identified some approximately 2,000 active primary close contacts linked to the outbreaks. More have been cleared, but more linked to the recent cases and exposure sites have been added. But overall, the net direction is in a downward trajectory for those primary close contacts. Of those, the main branches continue to be the city. There's more than 300 linked to the City of Whittlesea branch of the Kappa outbreak, more than 700 still linked to the Port Melbourne branch, 300 to the Arcare branch, and some 400 to the West Melbourne Delta variant branch. Over 6,000 other primary close contacts have been cleared, which is a good thing. Since the start of this particular outbreak, we have also had more than 100,000 calls and messages being sent to those cases and close contacts, and more than 10,000 houses have been visited by the Household Engagement Program, and I want to thank the Australian Defence Forces for their support as part of that program. Contact tracing teams have continued to work, as we indicated yesterday, on the notional links that have been built between the case that we announced on Saturday, that is the one residing within the City of Melbourne. That positive case lives in the same low-rise townhouse complex as the positive case worker linked to the Arcare Maidstone outbreak. And there was reason to believe, both from the genomic sequencing and from the epidemiology and investigations into that precinct, to point to possible exposure sites around a small number of internal facilities, and both discussions with those people and the genomic sequencing has confirmed those links. So yesterday, on the basis of that, the Department of Health contacted residents of this complex to inform them of that potential transmission risk and has asked them to isolate. Department of Health specialist nurses were on site this morning working with the residents, and a pop-up testing facility was established near the facility to make sure that we could make it as easy as possible for people to get immediate testing. Most residents will simply be required to test and isolate until negative, that is the Tier 2 contact process, but a smaller number, based on the epidemiological work that's been done to date, will probably be more likely to be Tier 1 exposures, subject to the conversations and testing that's going on at the moment, and will most likely have to isolate for 14 days. But that work is active as we speak. Investigations are also underway as to the ongoing source of the reservoir family of 4 last week, looking upstream to some of those exposure sites, which now of course date back some number of weeks. With no clear contact tracing yet established as to the precise locations for that, what I'll use this as an opportunity to is just to point to the fact that our contact tracers are looking at a number of cases that have been in or around the Thomastown Industrial Precinct just south of the Metropolitan Ring Road. There are as many as 10 public and private exposure sites within this particular pocket of Thomastown, with some broad overlap between a number of the positive cases. Nothing particularly definite, but as we seek to run down the last few chains of transmission, we want to use this as an opportunity to remind everyone who works in that industrial precinct, whether you deliver goods there, whether you are part of the service delivery to that particular industrial precinct, just to think about any symptoms that you may have had over the last few weeks and to get tested if you have, and to get tested more broadly if you show any signs of being unwell, and just make sure that you help running down the last few chains of this particular outbreak. Again, I stress this is not an exposure site as such. It's just a reminder to all of us to get tested if you have any symptoms. What we've seen over and over again in these outbreaks is that the critical lines of inquiry are there when we can make sure that people are doing the right thing as soon as they possibly can when it comes to any symptoms and exposures. The reality is that we need the confidence that broad testing numbers have and targeted testing into specific areas have to make sure that we capture all of the surrounds of these outbreaks and run down their various branches. So that's why the 16,932 tests that we recorded yesterday were very welcome, but we still would like to see increased numbers if you are reflecting even the slightest of symptoms, particularly at the moment. Getting tested and getting tested quickly in the some 200 sites right around the state, which have very minimal waiting times at the moment and can guarantee you a quick turnaround time, is the most important thing we can all do to make sure that our community our contact tracing team and our public health officials have the intelligence and the up-to-date information on the movement of the virus as we come, we hope, towards the end of this outbreak. We want to make sure that we get a head start on the virus. We want to make sure that we stay ahead of it and that we run down those last few chains of transmission. Just on vaccines, yesterday in the state-run sites, on a Sunday of a long weekend, we delivered 13,764 vaccines through the state's facilities, bringing a total to almost 800,000 through the state system. As we announced, I think over the weekend, the work of these centres will now focus on clearing the second dose administration for those tens of thousands of people who came forward over the last 3 weeks once we opened up, particularly the Pfizer vaccinations to the 40 to 49-year-old group. The 50,000 first dose bookings that are already in the system will of course go ahead as planned. And in regards to just the wider issue of vaccinations, as we get into a increasingly consistent higher rhythm, it's really important that when it comes to the Pfizer, that is the 40 to 49-year-old group, that people now book through the coronavirus hotline into the system to make sure that we have a a measured and planned system both for first and second doses as we seek to maintain the highest possible level of effective and efficient delivery of the Commonwealth's vaccination program. With that, I'm happy to take questions.
So will walk-ins for Pfizer not happen for the foreseeable future while you sort out the second dose?
What we're encouraging everyone to do is to book in for the Pfizer 40 to 49-year-old group. Now that we're having to essentially double up, as you would expect, when it comes to meeting the Australian Technical Advisory Group's guidelines on the period in which the second Pfizer dose is allocated, the best way to do that is through the booking system, and I would strongly encourage everyone to who's in that space to phone the call centre and lock in your time.
And with that South Bank apartment block, are you now saying
I beg your pardon?
South Bank apartment block, are you now saying that transmission between the RCare worker and that recent case has happened within that apartment building? Is that what you're saying?
That's the most likely line of inquiry. The epidemiology and the interviews with the two cases involved and the genomic sequencing seems to support that.
And how many people live in that apartment block and how many have been tested this morning?
I beg your pardon?
How many people live in that apartment block?
I don't have that exact number, but it's a townhouse complex with just over 100 townhouses as part of that complex.
And so the nurses that were sent there today, are they testing everyone in that apartment block now?
Yes, a note, an SMS went out to everyone who's on the registered owners list last night, and some material was distributed this morning, and door knocking and testing is actually well underway.
And last week the government was asked if there was a particular risk with that apartment block, and the answer was they didn't believe that there was a risk, but now there's been a transmission. So why has it taken so long to work that out?
Well, I think the question last week was on a different apartment block, because this was the one that we announced on Saturday, and that was in regards to a high-rise block. This is not a high-rise block, this is a townhouse set of arrangements.
So where do you think the transmissions happened in that area?
Well, that work is underway at the moment, and through some aspect of shared facilities is the working hypothesis.
Are those shared facilities laundries?
I beg your pardon?
Are the shared facilities in that area laundries, or what are they?
Oh no, they're not laundries. I'm not familiar with that amount of detail of the site directly, but as I understand it, it's but it's not laundries. I'd have to, rather than respond on the run,
Sure.
get that information when it's appropriate to. I beg your pardon?
If someone tests positive to COVID and they live in a big apartment block, is that block normally listed as an exposure site?
I beg your pardon?
So far, in the COVID outbreaks, if someone tests positive and they live in a big apartment block as opposed to in a house, is that apartment block typically listed as an exposure site?
Well, it all depends on the circumstances at hand. In this particular case, where we've the working hypothesis and the epidemiology and the genomic sequencing point to the very strong likelihood that that is the case, rather than wait for the community to come to the contact tracers and the testing facility, the local public health unit took the view that they should go to them, and I think that's a good thing.
Given that there are a lot of shared spaces in apartment blocks, lifts going up and down, potentially a pool, potentially a catering area, do you think that apartment blocks should be listed as exposure sites every time there's a positive case there?
Well, it all depends on the particular circumstances. So we take the advice of the public health team, who investigate each set of circumstances based on the merit of how things work out on site. If there is a case and the evidence supports listing places as exposure sites, then that's what's happening. And that's, as we've seen today, the response is out of an abundance of caution to make sure that we run down this particular line of transmission as quickly as we possibly can by taking the testing and the engagement direct to that community.
When you say it was out of an abundance of caution, when there was the first person from RCare test positive, was everyone then forced to get a test and be considered in that two-tier capacity, or not until the second person tested positive?
So everyone at our care was tested.
No, I'm talking about in the apartment block, from the person who got COVID but lived in that apartment block.
That the particular case from our care, the worker involved has, as I understand it, taken the offer that we make to many people who test positive, that if they have concerns about them self-isolating safely at their residence, that they move into hotel quarantine. So my understanding is that's what's happened in this particular
They
case.
moved into hotel quarantine?
That's my understanding.
Right, so they...
And based on the assessment that is made as to people's ability to be able to quarantine safely at home, those circumstances are determined on a case-by-case basis.
Sure, so if this person went into hotel quarantine to protect people, then why would there be a link to someone who lives in their apartment block who's also tested positive?
I've missed the last part of the question.
If this person from our care tested positive and they made the decision, as you say, to go into hotel quarantine, then why would there then be a link and someone testing positive at the apartment block that they live in?
That's precisely the work that's going on at the moment, but clearly the epidemiology and the genomic sequencing directly link the two, and it's obviously in some infectious period before the our care person turned positive, there was a transmission. And what we're trying to do is to run down the particular circumstances of that and make sure that if there are any chains of transmission out there, that we identify them early and cut them off. You're going to have to speak up, Surveyor.
Based on the date of when the care worker tested positive and also this person who tested positive on Saturday, when do you believe the transmission may have occurred and when do you believe they may have potentially crossed paths?
I'd have to get the specific epidemiology response back to you, not being a clinician in this space myself, but the work that has been done, I've been advised, does point to a possible crossover in the infectious period of the our care work.
And was this person who tested positive on Saturday, had they been identified as either a primary or a secondary close contact of the our care worker?
No, I don't believe so.
Vaccinations, you said that now it's important that people go through the hotline in order to book online, which makes sense, but people are having enormous difficulties with getting through, which is also understandable. But if we're telling everyone to get vaccinated as soon as possible and asking them to do it through a hotline that doesn't always work, there seems to be some problems there. What's the solution?
The hotline has now has 1,000+ people working on it, and the extraordinary levels of demand that we saw from a few weeks ago have mitigated a bit. That's not to say that there isn't still demand issues. Clearly there are. But every piece of advice that I've got shows that increasingly those capacity issues are being dealt with. It might well mean that people have to be a little bit flexible as to when they look at when their booking is, but there is a window of space that the Australian Technical Advisory Group on Immunisation sets, and we want to make sure that having started so well in that group of 40 to 49-year-olds, that we now calibrate our efforts so as to make sure that we have a sustained effort going forward in the Pfizer vaccination groups to tick over those vaccines as and when they fall due.
Minister Foley, new figures show that Victoria has fully vaccinated the lowest percentage of its population compared to other states and territories. Does that concern you?
That we're vaccinating
the lowest percentage of second doses.
Oh, well, that's exactly why we're now calibrating the system, having started so strongly in that 40 to 49-year-old group over the last 3 weeks, making sure that based on the increased allocation of Pfizer that we've now got from the Commonwealth, and we thank them for that, that we can address precisely that issue. I do point out that the state has delivered the highest level of vaccines in the country and is currently accounting for something like 40% of the total vaccinations right around the country. What we now need to do within the allocation that the Commonwealth provide us is keep that balance of first and second doses so we can get everybody fully inoculated within the constraints of supply that we're provided.
Minister, just on vaccines again, we're hearing from some frontline workers who got the AstraZeneca jab, some younger frontline workers got the AstraZeneca jab before the ruling was made that not appropriate for younger people, and now they're struggling to get they want to take the Pfizer jab and they can't because they've already had the AstraZeneca jab and they're worried they don't want to do it. What's your response to that? Is there any leeway there, or what's your response?
Well, the Commonwealth's vaccination program and that cut-off of the AstraZeneca for over 50s and the Pfizer for under 50s is a National Cabinet arrangement, and in terms of how prior to that arrangements went as to who got what, that mixing and matching issue is also an issue that the Australian Technical Advisory Group on Immunisations has advised on, and their advice nationally is that you should continue for the vaccine that you have initially been provided. So until such time as those rules change, they're the rules that the states and the jurisdictions have to operate under.
Closer to determining how the Delta strain leaked out of hotel quarantine?
That the Delta.
Delta.
So as I understand it, both CQV and the Department of Health were running down all of those. You recall Professor Cheng highlighted the 4 strains of inquiry, and work continues on all of those, quite substantial work, and some of those lines of inquiry are being closed off. But as we stand here today, none of those have established precisely what that crossover point has been.
And of those four working theories, does one hold up more than the others?
I'd have to get people who are more across the technicalities of these things, but all 4, I think Professor Cheng indicated which were more likely or not at the time, but all extensive work going back on work is still being done on all of them, but as yet none of them have shown anything that points to a crossover point.
Is there still a supply constraint with the Pfizer vaccines as well? Given people are a bit less hesitant to get the jab, would it be helpful if the federal government gave Victoria more to get those first doses rolling?
Oh, look, Victoria will distribute whatever it's provided when it comes to the vaccinations. Not just our state clinics, our GP networks are also calling for more vaccines, and of course other distribution points such as community pharmacies and others are also very keen. But the truth is we are operating under the constraints of what we are being provided, and that's an issue for the Commonwealth Government. Having said that, we're very pleased that because Victoria's been able to demonstrate such an appetite for the vaccines, that we have been allocated some extra, and we will continue to get those out the door as quickly and as safely as we possibly can.
But those constraints are the reason why you have to have this system for the second bookings and organise it in such a way.
Within the constraints of the supply.
Yeah.
You can't just endlessly go on first Pfizer vaccines when you've got to then calibrate the second vaccine within the timeframes that the Australian Technical Advisory Group on Immunisations requires us to. And moving into the future, our hope will be that we'll be able to keep those going at a 50-50 combined rate until such time as the population is fully vaccinated. Beg pardon?
The total number of mystery cases, we don't know.
Well, assuming that we run this City of Melbourne link down, we would think that, I'd have to get you the exact number because it changes as more evidence comes in, as we've just reported, but it would go to case 5, the original Whittlesea case, and the link to the missing link to the South Australian Hotel quarantine case as the foundation case. It would go to the first R-Care worker, which is not this particular R-Care case, another one. And it would go to the West Melbourne outbreak, so it would be at least those 3.
And how much?
But if there's more, we'll certainly let you know. But that's my understanding.
How much is this playing into the decision to ease further restrictions?
Oh, well, in regards to the cases today, both being linked to existing cases and both being quarantined during their infectious period, that's a positive. But as both Professor Sutton and the Acting Premier indicated yesterday, we'll have more to say about restrictions later in the week as more information comes to hand.
25k limit and to perhaps see football crowds back. Are we on track for that to happen towards the end of the week?
Well, look, clearly today is a relatively positive. No coronavirus case is a good thing. But in terms of the measures that the public health team and the government have talked about, today is a relatively positive outcome. So the conversations that we've been reporting over the weekend about potential further measures would still be on track.
And would we see football crowds back? Is that something that we could have see football crowds back, or is it going to be much slower before we get stadiums open to the capacity they were previously?
So it'll be a gradual, careful move should it happen, all around being built on the notion that we want to keep Victorians safe and we want to make sure that particularly when it comes to these very infectious variants compared to earlier outbreaks, that we are sure that we've run down these last few chains of transmissions, because the worst outcome would be to see cases missed and measures that would encourage transmissions to occur.
Minister Paula tweeting the 7-day rolling average for COVID cases in Victoria. Is that a metric that the government's using to ease further restrictions?
I haven't seen those tweets. But there's a range of measures that our public health team use to frame their recommendations.
Is that one of them?
There's a range and they vary from, as we've indicated publicly on many occasions, the types of cases, whether they're linked, the environment in which the high-risk settings they may or may not be a part of, whether the cases have been quarantining or not, whether they're mystery cases. All of those factors go into the combination of thinking that brings forward the public health team's recommendation.
Sorry, and just to clarify, this residential building you're talking about today, that's not Freshwater Place,
No,
right?
it's
Yeah,
not
it's a different one.
Freshwater Place is not a townhouse.
Yep.
It's a very, very tall building.
In Western Australia, they require international arrivals to have a day 17 test after they've completed their 2-week quarantine. Is this something Victoria would consider as well?
So for some time now, day, if it's 17 or 15, tests have been in the Victorian system, been in most states' jurisdictions, and that's been part of the furniture for a little while now.
Will you make it mandatory though?
I'd have to get back to you on that, but I think the national position was they were strongly recommended, and that's certainly been the case in Victoria.
Would you consider making it mandatory?
We would take any good public health advice on these issues, and if that was the advice that was come forward, then certainly we would take it.
And when you say later in the week with restrictions, can we look towards Thursday, restrictions coming off, or an announcement on Wednesday, just to give people certainty?
Well, we want to provide certainty to people, to communities, to businesses, particularly with school holidays coming up, as soon as we can. How long's a piece of string is the argument, but what we want to make sure is that we give certainty as quickly and as comprehensively as we can, based on the most up-to-date public health advice. And as we've indicated over the past few days, as soon as we're in a position to do that, we certainly will.
The townhouse. Any more information, suburb address?
It's in South Bank.
It's in South Bank, and it's not currently listed as an exposure site.
Not currently at the moment, but based on the conversations that are underway as we speak, and the testing that's underway, that may or may not change.
So that means that anyone living there, they would have the restriction rules apply, which could involve their partner or bubble buddy coming over to the apartment block, care if they need it.
Well, should that be the case, yes, but of course at the moment this is precisely one of the reasons why we've got the restrictions on private gatherings at residences to specifically...
Private gatherings don't
broadly
include having your partner come over
Oh, look,
or a bubble buddy.
if you have to isolate, if I understand the question, if you have to isolate as either a case or a primary close contact, as we've seen for the many thousands of people who've done that, there are measures in place to both check on your welfare and to ensure that you are quarantining, and that would apply equally to this particular case as it would to any other.
So are the residents being made to isolate at the moment?
I beg your pardon?
Are all of the residents being made to isolate, just to confirm? Sorry. Are all the residents being made to isolate at that apartment block?
Well, as we've indicated more broadly, if people have difficulty isolating and quarantining in their own residence for whatever reason, we enter into conversations with them as to what might be a better alternative, such as hotel quarantining. But what we do find is that overwhelmingly, with support, most of the primary close contacts safely and with lots of hard effort do in fact quarantine and isolate for that period of time at their residence.
But given that you were saying there's a possibility that transmission occurred at that apartment block, are people at the block being advised to isolate at least until they get a negative test?
Yes.
With that Thomastown area you identified to give you a bit more assurance?
Like we say, there's no. There's been a number of exposure sites, but they're not all necessarily linked. So at the moment, the view is, as we seek to run down the last few chains of transmission, where are some of the possible, really on the outer rings of things, opportunities to just identify some cases, if they're out there. And from the list of exposure sites that have popped up, not necessarily automatically linked, we think that the Thomastown Industrial Estate, just south of the Ring Road, is a possible candidate, and we would encourage anyone who's been in that estate over the last few weeks who shows any signs of symptoms to please come forward and get tested. It just might be that last piece of information that gives our public health officials the confidence and the certainty that we've run all chains down.
There's a 16-year-old boy in the Alfred who was in quite a serious car crash, and his mother hasn't been able to visit him despite living in regional Victoria since May 23. Why are visits banned, especially when he's a teenager?
I'm not familiar with the particular case, but we know that hospitals are high-risk settings in community outbreaks. We are, we hope, coming to the end of a community outbreak, and for the safety of both that young person, but for the well-being of the wider community, we want to make sure that we keep coronavirus out of high-risk settings. I understand that that is sometimes a difficulty for people, particularly who want to visit, but our healthcare professionals, our nurses, our doctors and everyone else do go to pretty long lengths to use technology and other forms of keeping families engaged in that process. So that's the situation as we look to care facilities, both here in Australia and globally, being really risky situations if coronavirus gets into them, and these measures are about making sure they don't.
Do you know if there was any situation where an exception could apply? The mother said that she's willing to get a COVID test just to be able... Do you know if there's any situation where an exception could apply? The mother has...
Oh, look, exceptions apply for end of life and other arrangements, but they're determined on a clinical and individual case-by-case basis.
The jammed phone lines were hampering contact tracing efforts. Someone from the health department's told News Corp that this is an issue that's yet to be resolved.
All right.
Are you confident that everyone trying to get through to contact tracers is getting through quickly?
So just from get the sort of base right here, most of our contact tracing work, which is now decentralised through the local public health units, is outward bound calls. Those, what I was referring to, of the hundreds of thousands of calls that have been made, our local public health units and contact tracing team have an outward bound focus on all of that. In regards to the exposure sites and a different inward bound phone number to the general coronavirus hotline, there were, at the start of the outbreak, this particular outbreak, you might recall there was one day when over 100 exposure sites went up one night, including Chadstone and a few other really big venues. That saw a spike in demand, and all those calls were triaged and logged and all responded to over the course of subsequent priority rankings. But that was the most recent challenge that system had. But I'm confident on all the material that I've seen that those challenges have been dealt with, and that the efforts of our contact tracing team, both outward bound and the inward bound calls relating to exposure sites, have been meeting all the benchmarks that the Finkel Review and others set in 2020.
Just to clarify again on the townhouse situation, so it's a townhouse complex in Southbank?
Yes.
A complex in Southbank Court.
Yep, with just over 100 units, quite a large area, with multiple entry points and car parks and other arrangements. But what we took the view was, if we want to run down these last few chains of transmissions, and we've got the ability to take the services and the engagement to that community, we should, because that will get the job done quicker, and we hope allow us to return to the 86 days of community-free transmission and more that we had previously.
Sorry, when did you think that transmission might have occurred?
That was a question that was asked before. I'm, rather than wing it, I will get that information to you.
Suburbs who were worried about delays in setting up help centres. Has that issue been resolved now? Do we have all the help centres for those areas sorted out?
Yes, all of the public hospitals and community health facilities have been back up since, over the course of the weekend. Some of the Latrobe Regional Hospital was cut off from Traralgon, but had some workforce challenges, but they were overcome. And a few had power and telecom issues, but they were all resolved some days ago. So all of our public health services are operating in flood-affected and storm-affected communities.
And relief centres are all up and running?
As I understand it, Minister D'Ambrosio will be out later today talking more about the flood and storm situation. She'd be more able to advise you on that than me. Very good. Well, last one.
Affected areas who say that in particular in Dandenong, they've yet to receive a visit from anyone from the government or from Emergency Management Victoria. What's your response to them who feel abandoned?
Well, what I know is that this has been an unprecedented storm and flood combination of events from over wide ranges of Victoria, from Trentham and Blackwood on one hand, all the way down to Sale on the other, and the Dandenongs and a whole range of other areas. I'm not familiar with the particular circumstances that you're referring to, but I know, because I've been on two of them myself, we've had a number of state emergency committee planning sessions. We've had the State Control Centre meet every day, and we've seen an outstanding result from whether it be our first responders, the SES, Victoria Police and others, and the power agencies, which had, as I understand it, in the many hundreds of thousands of consumers being offline for power, now down to some in the tens of thousands. That is still a significant number. And I do note that the acting Premier is one of those tens of thousands. But I do know that the Acting Premier in particular has taken huge focus on this. He was down in the flood areas of Gippsland yesterday. He has been around, I know, his own community in the Dandenongs yesterday, and there are very few people in the Victorian Parliament who work as hard or as engaged with their local community than the Acting Premier. And for that community being in the circumstances that it is now, I know that all the services led by the Acting Premier are taking a deep and direct role in seeking to restore those services as soon as possible. We want to make sure that every Victorian community is brought back online, is brought back on power, and is brought back to something that looks like normality as soon as we can. Everyone good? Thank you.